Your CNOS Health Watch on Siouxland News.
Most of the time, snoring is a common nuisance, but sometimes it's a symptom of something more serious.
Siouxland News reporter Katie Link has more on the possible dangers in tonight's CNOS Health Watch.
Obstructive sleep apnea is a common and potentially serious disorder that causes an individual to stop breathing during sleep.
Dr. James Case is a neurologist and certified sleep specialist at CNOS. He says sleep apnea can be mistaken for a bad case of snoring.
Loud and frequent snoring, choking or coughing during sleep, pauses in breathing, morning headaches.
Many times you aren't aware that you have sleep apnea. Your spouse will notice the snoring or pauses in breathing. Kevin Koch, a respiratory therapist, says it can have a real impact on your life.
And the core cause of sleep apnea is when the musculature in the back of the throat loses its tone during sleep. And what happens is that the tongue is a piece of muscle also. It will slide back and forms a physical obstruction to our airflow, hence the term obstructive sleep apnea.
And there are serious risks if you ignore the signs.
Studies have shown that if sleep apnea remains untreated, there's about a 4-fold increase in heart attack and stroke.
Diagnosis is pretty simple.
If you or your spouse think you may have sleep apnea, talk to your physician, and the appropriate testing will generally include medical interview followed by a sleep study.
Treatment can be as simple as using a sleep mask.
Treatment is continuous positive airway pressure, also called CPAP. That is a mask with a machine that's actually quite comfortable and generally well tolerated. That's used every night, all night.
For some patients, losing weight and not sleeping on your back can help as well. Kevin is not just a respiratory therapist, he's also a sleep apnea patient himself. He says he has more energy and feels great since he started using the CPAP machine.
So I can tell you truthfully from firsthand experience that the treatment of sleep apnea is effective and it works.
For Siouxland News, I'm Katie Link.